Good evening. Thank you for coming out tonight. It's a real pleasure to welcome you to the President's Distinguished Speaker Series at Wabash, and tonight's featured guest, Dr. Bob Einterz, Wabash Class of 77. We're here because of the generosity of a lot of alumni, principally Larry Landis, who had a great idea about 10 years ago to establish a fund that would allow us to bring really smart, creative, thoughtful leaders with hopes of inspiring our students for future generations. And I hope tonight that will happen for each of you. And we're grateful for Larry and his vision. I've spent most of my life writing for other people. I have a distinction tonight, a rare distinction, that I am writing what someone else wrote. David Shane, our Emeritus trustee, class of 1970, was supposed to do this introduction, and he's unfortunately unable to be with us, and he asked me to present his remarks. We are privileged to have Dr. Robert Einterz here tonight. Bob was raised in South Bend. After Wabash, he trained in internal medicine at the IU School of Medicine, served as chief medical resident at what is now Eskenazi Hospital in Indianapolis, spent a year with his wife, Leanne, and newborn child in rural Haiti, directing a primary health care program, and went on to a long career of vision, compassion, and results. In 1989, Bob and three colleagues founded a partnership between Indiana University and the Moi University, located in Eldoret, Kenya. Over the next decade, Bob built the partnership's work, including coordinating the Moi Department of Medicine, co-directing the Moi Medical Informatics Fellowship, and serving as the principal investigator for numerous grants in Kenya, including, for example, PEPFAR, the President's Emergency Plan for AIDS Relief. Building on the foundations he and his colleagues established, in 2001, Bob co-founded AMPTAH, the academic model providing access to health care. Now, for a quarter of a century, AMPTAH has worked for and helped the people of Western Kenya. What began as a local collaborative exercise in rural Eldoret is now much, much more. A consortium of 20 research institutions, academic health centers, and their partners, including Kenya, its government, and its people. These partnerships are providing medical trainee exchange programs and hands-on education, fostering long-term cross-cultural engagements, and improving the lives of populations and communities with significant unmet healthcare and related needs. The foundational work of AMPTAH is health, seeking and creating dramatically improved results for people of Western Kenya, still attentive to HIV, but now far, far broader and increasingly comprehensive, including, and wait for it, it's a long list, primary care, specialized and critical care, surgeries, cancer, diabetes, cardiovascular disease, and other chronic diseases, children and women's health, mental health, specialty care, support services such as radiology and pharmacy, medical education and training, clinical and public health services, food security, prevention of communicable disease, family preservation, social health services, counseling, and critically, the layers of partnerships and collaboration and communication and engagement and support that enable all of those things. What Bob and his colleagues in AMPTAH in Kenya have built is now a system of sustainable care for an entire population of more than 24 million people in Western Kenya, training thousands of medical students, medical professionals, and community health workers, serving in Moi in over 300 clinics and in other sites of care in the field. Implementing real-time electronic medical records and efficient decision support, improving patient engagement, follow-up, and care. Building a deep and focused research network leading to discoveries that are creating better policies and better care. Caring for over 100,000 AIDS patients, providing home-based testing for over 1 million people, and lowering the mother-to-child transmission rate to almost zero. Providing comprehensive medical care to millions of Kenyans, and going beyond medical efforts to the empowerment of training and support for self-sustaining agricultural practices, improved income generation and savings, partnerships seeking to provide comprehensive, accessible, affordable health care for all. Of particular note for Bob's visit tonight, in a year when we're focused on civility and community, Bob and his colleagues have met people where they are, respected and trusted them, cared for them, gave them stability, and enabled and empowered them to manage their own circumstances and build their own futures, not just improving health, improving lives and futures. The work is always personal, built on face-to-face relationships, mutual trust and respect, fostering civility and community throughout. Not transactions, relationships. Not doing to, doing with. Not in isolation, in community. The gains in medicine and health and stability follow. The respect and trust and civility and community lead and enable. A critical, enabling, sustaining approach, an enduring lesson for these difficult times. Bob was there at the beginning and throughout. Even in his recent retirement, his legacy remains and will endure. At the heart of AMPATH, its institutions and its people, its work and its results are Bob's anchoring principles of respect, trust, civility, and community. We are grateful Bob is with us tonight to share his reflections and thoughts. Please welcome him.
Are we on? Good, perfect. 36 years ago, I was standing in an airport terminal in India, staring at a monitor on the wall announcing that my flight to Nepal had just been canceled. I was jet-lagged and in a sour mood, having traveled a sleepless night from Indianapolis to Europe and on to India. The abrupt cancellation of that scheduled flight triggered me to blurt out a few choice words about airlines, corruption, dysfunctional systems, and unhelpful airline personnel. When I finished my rant, one of the three colleagues with whom I was traveling pulled me to the side and said 6 words to me that I will never forget. "Bob," he said, "your ego is not on trial." Jim Amadon asked me to speak for 40 minutes, maybe 35, but a good part of me wonders if I should sit down right now, for the essence of my talk is contained in those 6 words. My wife, Leanne, here in the audience, a clinical therapist, she once said to me, "Can you imagine a world where everyone checks their ego at the door of their cars, the door of their classrooms, their boardrooms, their bedrooms, Salter Hall? If our egos are not on trial, if we check them at the door, our world would be healed." On that around-the-world trip nearly 4 decades ago, my 3 colleagues and I were taking the first steps in our efforts to expand Indiana University's global reach. But as my colleague observed, changing one's world begins, and in many senses ends, with changing oneself. During my career at IU, as Jim noted, I worked as a primary care clinician in a clinic on the near west side of Indianapolis, as a hospitalist at Wishart and then later called Eskenazi Hospital, and as the founding director of the IU Center for Global Health. Now, each month on my clinical inpatient team, I received new medical students and trainees, interns and residents. As I oriented them to their obligations and my own expectations, I tried to emphasize 2 points. The first point: if you're not becoming a doctor to change the world for the better, then you're in the wrong career. Or, of course, if I was teaching or mentoring an artist or a businessman or a banker or a cook or a plumber or whatever, I'd give similar advice. If you do not believe you can change your world for the better in your chosen field, you're pursuing the wrong career. Or perhaps you just haven't examined your chosen field closely enough. For wherever and whenever you act with integrity and civility, you engender hope within your community, thus empowering your neighbors, fellow citizens, and yourselves to thrive and flourish. As for the second point of emphasis, I would try to encourage my students to treat all patients humanely. Now, Eskenazi Hospital welcomes all people irrespective of the size of their wallets and their pocketbooks. There are several hospitals in the Indianapolis area, as you know, and the surrounding areas, but for most individuals who live on the margins of our society, particularly those who are financially impoverished, they have no choice. Eskenazi is the only hospital that will consistently serve them. This was particularly the case before the Affordable Care Act, or Obamacare. Most of the individuals who walked through the doors of that hospital came from an environment or a culture that most of my med students and trainees had never experienced. So I would remind my students, you will be called to care for patients of many different stripes. However, I'm certain of one thing. Every patient that you care for is somebody's mother, every patient that you care for is somebody's son or somebody's daughter, and usually somebody's mother or father, grandmother or grandfather, aunt or uncle, brother or sister. And I tell my students, I don't care what they look like, I don't care how they treat you, I don't care how they smell. You are to treat them as you would a son or a daughter, a mother, a father, grandmother, grandfather, or brother or sister. And I would tell them that you were to do this whether you're in the room with them or not. You're here in the staffing room, you're talking with your colleague in the elevator, or you're at home with your partner reflecting on your day. You're to treat your patients with respect. And then I'd add, just for good measure, and if you don't do that, I'll flunk you. We are a flawed, imperfect species that exhibit an astonishing duality. The power to love and serve others with compassion and empathy, and the power to hate and commit heinous acts of violence. I will reflect this evening on civility and community in the context of my own life journey with examples such as I just related, where at times I behaved in uncivil fashion, and other times when my better angels guided me to make better choices. Now, when my 6 kids, and I have my youngest in the audience here with us, when my 6 kids were young, I made a point of reading Greek myths to them. My 2 favorite stories are the stories of Achilles and the myth of Sisyphus. I like Achilles because it reminds us that everyone is flawed. As for the myth of Sisyphus, it reminds us that we will struggle and we will fail. Life, it seems to me, is a series of choices and actions, successes and failures. Quoting and paraphrasing Sam Anderson, a journalist for the New York Times, in a recent article that he wrote about the futility of this year's Chicago White Sox, he wrote, "To live is to lose in all the many senses of that word. To lose socks, friends, arguments, opportunities, brain cells, and everything else. To lose, and I would add to fail, and to deal with loss or failure is one of the most profound things a human can do," end quote. In a life well lived, it seems to me, one learns from one's actions, self-corrects, tries again, succeeds or perhaps fails, but in failing always fails forward. Now, 2 of my younger brothers, Mike and Andy, also graduated from Wabash College, as did one of my sons, Seth, and one of my nephews. Andy, my brother, was the youngest boy in our family of 8 girls and 5 boys. Andy was by far the most talented and gifted of any of us. A superior intellect, a whiz at math, a gifted athlete, a humble personality, and a terrific wry sense of humor. But he wasn't perfect, and like each of us, he was burdened by his own unique set of demons. Andy played football and ran track at Wabash, though he was booted off the football team sometime in either his freshman or his sophomore year, I don't recall. His tenure on the track team lasted longer, throughout all 4 years of Wabash. Rob Johnson, the coach of the Wabash track team, got to know Andy pretty well during that time. My brother Mike, who's in the audience as well here this evening, my brother Mike and I had a pretty good sense of the angst and frustration that my brother Andy was surely causing Coach Johnson. Now, when Mike and I attended Wabash, long before Andy matriculated here, we participated in track and field. I like to say we were pedestrian competitors. Mike threw the javelin and I threw the discus. Though Coach Johnson had limited experience coaching throwers, we had a great fondness for him. He was confident and passionate, but never arrogant. Always positive, always focused outward, expressing kindness and hope, intent on serving a generation of Wabash men and later their spouses and children. Now, on July 4th, 2020, it was a really hot day. My brother Andy, at age 53, went out for a jog. He returned prematurely to his house. He collapsed on the kitchen floor in front of his wife and his eldest son. He seized and died. And with that, though he was the youngest, he was the first of our siblings to visit the underworld. Andy's wake was in Noblesville just a few days later. Though we had not contacted Coach Johnson, Coach attended it. From my perspective, Coach Johnson was making a choice, a humble, caring choice that said to my family and me that despite our flaws, or maybe perhaps because of our flaws, I am here with you, I am here for you. In making that choice, Coach Johnson earned an eternity of gratitude from my family and me. One definition of civility is a disposition or act that affirms human dignity and uplifts our community. If you are seeking a quintessential example of civility, you're looking in the wrong direction. Instead, turn around and look at Wabash's own Rob Johnson. There is no finer example. And he's right there. One of my initial experiences in so-called global health was a 2-month stint after medical school, but before beginning my internship when I volunteered at the Turtle Mountain Indian Reservation in North Dakota. I'd gone to medical school thinking that the biological and medical sciences were the key to improving human health and well-being, but while observing what was happening on that reservation, I began to realize that the defining role that poverty, hunger, gender discrimination, transportation, violence, addictions, shelter, racism, and many other social factors play in determining the health of individuals and their communities. Put differently, I began to understand more fully how social inequities can disrupt and destroy communities and how failing communities, conversely, can adversely impact individuals. Now, living in and observing other cultures can give one clarity and insight into one's own culture and community. It was on that Indian reservation, and then later in Haiti, and later still in Kenya, that I came to understand the power of civility and community across America, as well as the pernicious, sinister consequences of hate, fear, division, and retribution. After finishing residency, I joined the faculty at IU School of Medicine for a year, saved half my salary from that year, and then volunteered in a remote village with my family in Haiti. At the time, I believed that all physicians had an obligation to give back to their communities, whether locally or globally. My role during that year in Haiti was to develop and implement a comprehensive primary health care program under the auspices of the Haitian Ministry of Health and a now defunct American NGO. At the time, my wife and I had 2 small children, both in diapers. We lived in a cinder block house with a sheet metal roof, no electricity or running water. We hired a young woman to fetch 10 or 15 gallons of water for us to use every day from a local water source. It was an interesting year. It was during that year that I first learned and capitalized on the value of community health workers. Now, I tend to view society as systems founded on the back of institutions, those institutions in turn founded on the integrity of individual relationships. In other words, the basic building block of our world community, are each one of us and the relationships that each one of us form with another individual. When those relationships are based on mutual trust and respect, our communities will thrive and flourish. When our relationships are disrespectful or mistrustful, we will not achieve the potential that derives from collaboration and cooperation. The common good will suffer, and our communities will wither. Now, community health workers are individuals who reside in or come from the community that we are trying to serve. They're not physicians, and generally they're not even trained in any of the traditional healthcare professions. They are individuals who have already earned the trust and respect of their neighbors, or at the very least, they are individuals who can more easily earn the trust and respect of their neighbors, more easily at least than someone who looks like me, dresses like me, talks like me, or is me. Their primary role is to advocate for their communities, to listen and respond to the voices of their neighbors, and to give voice to the voiceless, so that individuals in the community who have been marginalized can be heard. In each of the settings in which I have employed community health workers, in Haiti, then Kenya, then in Indiana, they are able to see what I cannot see, hear what I cannot hear, and speak about needs, fears, and concerns that I might not otherwise have recognized or understood. Having a voice in one's community dignifies the individual and is critical to the proper functioning of our own democracy. In my third year at Wabash College, I chose to take an elective class taught by Professors Bert Stern and Don Baker, Creative Writing in Poetry. It was in that class that I first read Wallace Stevens' poem, Evening Without Angels. It's an inspiring poem, one that I've returned to periodically over the years. In the context of the poem as a whole, the last two lines in particular have stuck with me. Where the voice that is in us makes a true response, where the voice that is great within us rises up. Baker and Stern had a reputation for being challenging professors. So one might think such an elective was really not in the best interest of a student trying to get into medical school. But the reality is that class and its emphasis on understanding and expressing the human experience prepared me as well, if not better, for my career as a physician and a leader than any other course of study at Wabash College. Now, like all of you, there are times when I get unduly frustrated and intolerant of the folks around me, such as my brother in the audience. Now, when that happens, I try to remember the words of Wallace Stevens. Every individual has a voice that is great within them. I just need to listen to it, or listen for it. I recall a patient I saw in my outpatient clinic in Indianapolis many years ago, dressed in this baggy, tattered shirt, oversized pants. Larry, he looked at me with these vacant eyes. Around his shoulders, he had slung this Indianapolis Star paper bag. It was the same bag that I had seen him carry on his shoulders on numerous times when he'd visited my office previously. I figured he'd been a paperboy once. He didn't bathe very often, and the odor that seeped from his clothing reminded me of a wrestling room. In his 40s, he had the mental capacity of a grade schooler. "I don't feel good," he said to me. I'd been hurrying to finish my last few patients, go home, and relax with my family. I'd examined Larry many times in the past, but something in Larry's eyes that day called me to slow down and listen. In a monotone, gravelly voice, his fears spilled out. He told me about his mom, her death from cancer a year previously, his life without her, and his terrible loneliness. I didn't say a word, but after he finished telling his story, Larry smiled, his eyes brightened. He stood to leave, extended his hand, and said, "Thanks, Doc." The sacred trust that physicians hold with their patients, or you might have with a friend, a partner, or a confidant, can be a window into the soul. It allows us to share in great joy, but also to witness great suffering, including some of the darkest, most crippling acts that one human being can commit against another human being. Most of us, myself included, do not fully understand the magnitude of these personal tragedies, the suffering, the shame. But I am convinced that by listening, truly listening to those who suffer, each of us, whether physician or not, can help them find the way back to wholeness. It's not an easy task. We think we listen, the psychologist Carl Rogers said, but very rarely do we listen with real understanding, true empathy. Yet listening of this very special kind is one of the most potent forces for change that I know. Shortly after returning from our year-long stint in Haiti, I met another Larry at a gas station on 10th Street in Indianapolis. I had first met Larry when I was in high school helping my dad on Saturday mornings coach a kids' football team on the near west side. It was Indianapolis, by the way, not South Bend, where I grew up. At that time, it was clear to me that Larry was different. He didn't show much aptitude for the game of football, but he was a happy-go-lucky kid with a really easy smile and a very pleasant personality, and I took a liking to him, took him under my wing, tried to teach him the fundamentals of football. I mostly failed, and the season ended. Now, I didn't see him again until that day at the gas station nearly a decade later. We chatted. He explained that he had gotten into drugs, had dropped out of college, but he's trying to make a clean break. He was in counseling, had stopped using, and was trying to re-enroll at IU. But he explained he owed the university some money for non-payment of fees, and he asked me, thinking I think now that he was thinking I was this rich doctor, he asked me for $1,000. I demurred. Leanne, my wife, and I had spent nearly every dime we had to sustain ourselves and our family in Haiti. I was still paying back a medical school loan, and the sum total of our entire net worth and savings was $2,000, and Larry was asking for half of it. What to do? Leanne and I discussed the matter. We had had a successful, meaningful year in Haiti. My more practical, maybe rational brain told me that now was the time to invest in our family. But then Leanne asked, what kind of ROI, return on investment, what kind of ROI are we seeking? A financial return or a social return? You've got a good job, she said, and though our bank account is meager now, our lives are rich and our future is bright. So we gave Larry $1,000 with the proviso that he share his grades with us at the end of each semester. He re-enrolled and several years later graduated. I then lost track of him for another decade until I stumbled upon him at a downtown office in Indianapolis where he was directing a non-for-profit whose mission was to assist gay men, and I could not have been prouder of him. Just last month, Dr. Feller, I was discussing Larry's story with my brother-in-law, and I acknowledged that if I had chosen not to invest in Larry, but instead had taken that $1,000 and invested it in Google and Amazon, who were issuing their IPOs around that time, I would be $2 million richer today. And just look at how much I could have donated to Wabash College. Did Leanne and I make the wrong choice? He'll answer that question tomorrow. As I've noted already, after Haiti, I rejoined the faculty at IU as a clinician teacher. I had scratched my itch for global health and global citizenship, if you will, and I was prepared to focus exclusively on the population of Indianapolis in my duties with IU and Wishard, but I was bothered by how difficult it had been for me to find a volunteer opportunity in global health way back then, and I wanted to try to create an accessible avenue for other physicians who had similar inclinations. So I proposed to my division chief and two of our colleagues who had had volunteer experiences overseas that we create a formal partnership between Indiana University and some other place in a low-income country. After some searching, we partnered with Moi University in Kenya as they were attempting to bring up Kenya's second medical school with a very novel curriculum to promote and nurture community-based healthcare. Now, this partnership between one Kenyan academic health center and one American academic health center was based clinically within the Kenyan Ministry of Health and their affiliated hospitals and health centers. The partnership aimed to create a system of health care delivery responsive to the health needs of the population, whereby the community became, if you will, the classroom for education and the laboratory for research. The basic building blocks of this nascent institutional partnership were, of course, individual counterpart relationships, collegial relationships between one Kenyan and one American, and again, based on mutual trust and mutual respect. Now, at the inception of the partnership back in 1990, IU committed to keeping one of its faculty members on ground in Kenya for a year at a time on a rotating basis. Leanne and I, with our then 3 young sons, were the first Indiana team leaders on ground in Kenya. To give myself and Indiana University the best chance to create these trusting relationships, I made a very deliberate decision. And during those first 6 months of the year, of our year there in Kenya, to just listen, to question my own assumptions when anything struck me as particularly right or particularly wrong, and to refrain from judging or even offering an opinion unless directly asked to do so by one of my Kenyan colleagues. In the subsequent 3 decades of preparing thousands of American students, trainees, and faculty members to participate in the program, my own experience influenced the advice offered. Try not to judge. Rather, if something strikes you as particularly offensive, or conversely, particularly welcoming or good, try not to react immediately. Rather, first ask yourself, what assumptions am I making that cause me to respond so negatively or positively to any given situation? The first 10 years of the partnership really were a resounding success. I worked there for the first year, and the following year, and thereafter, a different IU faculty member assumed the role of team leader in Kenya, while I continued to direct the overall program from my base in Indianapolis, though I would travel to Kenya 3 or 4 times every year. In that first decade, the partnership expanded to involve numerous departments within both schools of medicine and then numerous schools within the 2 universities. The number of Americans on our team in Kenya grew substantially, and by the year 2000, 10 years into the partnership, bilateral educational exchange and collaborative research were thriving, and the clinical care system within the hospital and affiliated community health centers had noticeably improved. But then there was Daniel. Daniel was a Kenyan medical student. The IU team leader in Kenya at the time, Joe Mamlin, discovered Daniel on the wards of the hospital. At first, Joe did not even realize that Daniel was a medical student. Did not realize that the man dying in front of him was a student there at Moi University, until 2 of Daniel's classmates came to the wards of the hospital to provide Daniel comfort in what appeared to be his very last days on this earth. As Joe described him, Daniel was too weak to feed himself, too weak to care for himself, too weak to get out of bed. Daniel was dying of HIV. At that time, though, medications were available in the US and Europe that converted this certain death sentence into a lifelong chronic disease, not a single person in the public sector in Kenya had been treated for HIV. Joe called me from Kenya. Could we mobilize the resources, he asked, thousands of dollars at that time, to provide the medications and related medical care that this young man needed? The answer, of course, was yes. So Joe started to treat Daniel. And after a few weeks, Daniel began to improve. And a few weeks after, he was feeding himself, he was caring for himself. And a few weeks more, Daniel rose from his deathbed, stood, and walked out of the hospital. And for the very first time in the public sector in Kenya, Americans and Kenyans together witnessed the amazing power of these drugs. We called it the Lazarus effect. I wish the story could end with that happy ending, but it doesn't, at least not yet. At that time, nearly 2 decades ago, Daniel is now one of the first, probably the first person in Kenya to openly acknowledge his HIV status. But the stigma against individuals with that disease was so great that his landlord refused to allow him to come back to his apartment, and Daniel had nowhere to go. Fortunately, by this time, Indiana University had expanded the size of its team in Kenya, and we were occupying multiple houses. So Indiana University wrapped its arms around Daniel, embraced him, and welcomed him into their home. 2 decades later, Daniel was still thriving, leading one of the largest HIV outreach programs in the world. Well, Daniel was our first successfully treated patient. But what about the hundreds of thousands, millions of other Kenyans infected with HIV who had been given the same death sentence? For example, at one of our antenatal clinics in Western Kenya, prenatal clinics, 1 out of every 3 pregnant women were infected with HIV. Almost half of them were poised to transmit that deadly virus to their newborn child within the first 2 years of life, but not a single woman knew that she was infected with HIV. I wish I could tell you the full story about what happened next, but time prevents me from doing so. The very short story is that we, mostly Kenyans, and just a few Americans, all working under Kenyan leadership, opened 2 clinics, one in a rural area and one in an urban area. And then we opened 4, and then we opened 8, and then we opened 16, 32, and we kept on going until we had more than 300 clinics open, covering a population of more than 20 million people. Many of our initial patients were women. In fact, most of our initial patients were women, woefully impoverished, unemployed, and often starving. They had waited for their husbands to die of HIV before they could seek treatment. For to do otherwise was to risk rejection and banishment from the man who had given them the disease in the first place. It was obvious that if we wanted to build, or should I say rebuild, a robust, healthy community, we would need to address the social determinants of health. For just as we had witnessed elsewhere, men, women, and their families cannot thrive when their bellies are empty, and without meaningful employment, human beings lose dignity and their communities collapse. So we, Kenyans and Americans working together and always under the leadership of Kenyans, not Americans, set out to provide life-saving medical service while simultaneously addressing matters of food security, income security, shelter, and gender equity. To tackle these problems and many more, we needed additional partners. The challenge was the following. In a world where US institutions tend to be insular and competitive, for they have egos too, could we entice them to join us under IU's umbrella while embracing our Lead with Care model, a model that is not at all customary among top-notch universities that boast of their education and research missions, but rarely, if ever, hold themselves accountable to the health of the communities and the population in which they are located. Would those institutions of higher learning and IU be willing and able to subdue their own institutional egos for the common good, and if so, how to make that happen? Shorter answer is yes, of course. To the first part of the question, and as to how to make it happen, well, that's another lecture, maybe a semester-long course. As I mentioned previously, nearly 1/2 of our HIV-infected moms in Kenya, if left untreated, will pass the deadly virus to their newborn child sometime in between birth and 2 years. But with treatment, that transmission can be completely prevented. So there was a time in the early stages of our partnership's efforts to treat HIV and to control HIV, we call this partnership AMPATH, when we were patting ourselves on the back for the wonderful success we'd had treating the women who presented to our prenatal clinics, until we recognized that most of the women weren't ever coming to the prenatal clinics, and in fact, they weren't receiving any prenatal care. What to do? Well, our response should, I hope, now be familiar to you. You would be able to do this yourselves, right? Let's organize groups of community health workers, leverage them to gain the trust of community members, village leaders, and people in their homes, while simultaneously enabling leadership to hear the voices of everyone in the community. The importance of respecting and acknowledging the dignity of every single person cannot be overstated. But that respect and acknowledgement does not come easily. Humans have an unfortunate tendency to be tribal and divisive. We're white, they're black. We're male, they're female. We're Republican, they're Democrats. We're Ukrainians, they're Russians. We're little giants, they're tigers. There are positives that go from being members of a group. As Tocqueville observed, it was small group associations that made America unique and strong. However, when the identification with a group trumps the common good, such incivility destroys community and robs individuals of their dignity. We had our challenges bringing up AMPATH. There are times I've been asked, well, what was your greatest challenge? And my answer is always the same: Americans getting along with Americans. But we had other challenges too, particularly the ethnic violence of 2007 and 2008 there in Kenya, when Kenyan politicians stoked ethnic tensions to mobilize political support. From my perspective, one of the most pernicious and damaging tactics was when individuals, particularly leaders, referred to their perceived opponents with disparaging or dehumanizing names. To refer, for example, to a person as a snake or a rat, or as we saw in Rwanda years previously, to refer to another human as a tree, is a siren call to our own egos. It makes it easier for us to see the other person as not fully human, facilitating and catalyzing thoughts and actions that are unseemly and undignified at best, and at worst, violent and deadly. It is the antithesis of the mission of Wabash College. So perhaps you're asking yourself, well, how does one develop a successful and thriving interpersonal relationship? Well, for the answer to that question, I once again credit my lovely wife, Leanne. Recall, she's a clinical social worker whose job is to counsel individuals and couples who are having challenges in their personal relationships. I've learned a lot from her, really have. She is living proof of the time-honored adage, behind every successful man stands a woman rolling her eyes. This is true, right? Okay. Parenthetically, she frequently offers this reassurance to prospective Wabash moms. Wabash men, she says with authority, Wabash men, they always marry up. It seems my son's nephew, brother, might agree with her on that as well. At any rate, in her practice counseling partners on developing strong interpersonal relationships, she frequently mentions the 4 horsemen. Now, most of you are familiar with the book of Revelation and the 4 horsemen of the apocalypse, right? This is not what she's referring to. And some of you are probably thinking the 4 horsemen of Notre Dame, right? The 4 players in the backfield of Notre Dame's team in 1924 that handily defeated Wabash 34-0 that year, not negating our 5-0 conquest of Notre Dame in 1905, right? Leanne's not referring to them either. Rather, she's referring to John and Julia Gottman's 4 horsemen: stonewalling, defensiveness, criticism, and contempt. The Gottmans are psychologists who derived the 4 horsemen from rigorous research on couples. Like the 10 Commandments, the 4 horsemen are shall not directives. Thou shalt not stonewall thy partner. Thou shalt not criticize thy partner. Thou shalt not respond with defensiveness to thy partner. And most importantly of all, thou shalt not ever show or harbor contempt of thy partner. Far better to accept your partner's idiosyncrasies and perceived flaws as gifts that define your partner, express their uniqueness, and make them human. Communities and relationships are inherently fragile. Building relationships, programs, institutions, and systems takes a lot of time and a lot of effort. Destroying relationships and the communities that they form is unfortunately relatively easy. Again, hate, fear, division, and retribution, especially when promoted or nurtured by leadership, will work nearly every time. It behooves all of us to be on guard against such behavior. While remaining civil in our response, we have the duty to counter such incivility whenever and wherever possible. In my retirement from the practice of medicine, I have tried to embrace building community by serving on the board of directors of Indianapolis Ballet. Indianapolis Ballet consists of a dance school and a professional ballet company. The dancers come from around the country, and they are as good as, if not better, than the ballet dancers in our nation's most prestigious ballet companies. Indianapolis Ballet is an example of the true heart of America, a small group association that nurtures community. Ballet is an expression of beauty and the human spirit with a 400-year tradition. It combines athleticism, grace, and musicality while instilling and inspiring bedrock values. Like the practice of medicine and the arts in general, ballet has the potential to refresh, to renew, and to heal. I invite and encourage you to attend a performance of the Indianapolis Ballet. You will discover beauty, truth, and a touch of the divine. Take a partner too, you'll be glad you did. In closing, I'd like to thank Jim Amadon and David Shane for their gracious introduction, Larry Landis for his generous support of this lecture series, and Scott Feller and Jim Amadon for inviting me to speak this evening, and especially all of you for attending this event and listening to my perspectives. I prepared by reading several articles, several books, multiple articles. Alexander Hudson's The Soul of Civility was particularly germane. It helped me hone my thoughts, influenced my selection of anecdotes, and gave me some additional language to express my own perspectives. I trust that you chose to attend Wabash College because you recognized within yourself the potential to change our world for the better. You made the right choice. Respect and nurture the inherent dignity of all people and surrender your ego to the common good. You will succeed. Thank you so much. I'd be happy to take any questions. So we've got 10, 11 minutes here, and I know Rick Gunderman did a hell of a lot better job than I can do, encouraging you all to ask questions from 2 weeks ago for those of you who attended his talk. But yeah, I'll take any question on any subject, and I may or may not have the right answer. Yes, yeah, and if you could bring the lights up a bit of the audience if it's possible, because it's hard to see it. Go ahead. Yeah, so the question is being a good listener a matter of just exactly what you said was not giving your own input? Yeah. I think it really varies, right? It really does vary. I think that, and again, don't look at me as being the model of civility. My wife and daughter and brother could probably attest to that. But in terms of there are times I've been a really good listener, I think, and there are times when I've been a very poor listener. And much of it relates to, I think, first and foremost, respecting the inherent dignity of all individuals. That's the very first thing. I think, secondly, we are almost programmed, I think, to want to judge. And we're almost programmed, again, our ego, we want to tell people what to do. I struggle particularly with my own kids because I want to tell them what to do because I know they're screwing up and I know the right answer, right? Can't do that. Is that right? My daughter's sitting here. Yeah. So I think it's that. Sometimes, in fact, it is like I did with Larry. I mean, it just blew me away. It was the first time I think I really began to understand that sometimes saying absolutely nothing is the right thing to do, and in other instances, cultivating compassion and empathy demands, of course, that you say things. Figuring out exactly how to say things or what to say, when to say it. I think Dr. Herzog is in the audience here somewhere, and certainly Bert Stern and Don Baker were helpful, as was Dr. Williams, who's back here in religion. And this is the beauty of the liberal arts. Hopefully it gives you that foundation upon which you can grow to begin to understand the person that you're with. It takes a lot of practice and a lot of thought and reflection. Yes?
Someone as involved and accomplished as you've been, is there a time, at different times in your life when you suffered from maybe burnout, or where you have felt like you poured so much out of yourself that you feel lost because of that? And if so, how do you come back?
The question is, are there times when I have felt burnout, and if so, how do I respond, or how can I be resilient in the face of some really terrible struggles? The answer is yes, of course. There have been many, many times when I've thought that I've rolled my boulder, right, myth of Sisyphus, right? I think my own medical students, I was really disappointed. I'd always talk about the myth of Sisyphus, and half of them never knew what it was. So for those of you who maybe don't recall the myth of Sisyphus, it was, he defied Zeus, and Zeus condemned him to roll the boulder up the hill, and just as he got to the top, it would roll back down. You had to roll it back up, roll back down. This is life. This is the persistent failure that we have in life, the persistent struggle. And of course, the thing, those of you who are reading Camus and his existentialist views. So yeah, absolutely, after every mountain is another mountain, is the other proverb. So yeah, this happens to all of us. It's part of the human experience. And I can tell you, the one thing that my colleague Charlie Kelly once told me, and Charlie's on his deathbed right now, in fact, in Indianapolis. He may have died today. He was one of the 4 that went around the world and helped start this program. And Charlie, when I was feeling really down and feeling like we were failing yet again, Charlie said to me, Bob, never underestimate the power of a good example. And basically he was saying, keep your nose to the grindstone. You don't think right now, and you don't feel people deriving hope from just the fact that you're doing good work, but they're deriving hope from the fact that you're doing good work. And I oftentimes will fall back on that when things are going poorly. Yeah, for sure, life is not a bed of roses. It certainly hasn't been for me, and I've had my share of struggles. But it's as Leanne would tell you, it's through the connections with other people that you really derive the hope that you need to carry on. And you have the power to give that to people. Everybody in this room has the power to give that hope to other people. And it's such an enormous gift if you choose to do it. Let me see how we're doing time-wise. We're good still. Other questions? Yeah. My brother wants to ask me a question. Should I take this question or not? No, it's not. Yeah.
How does your ego deal by not being the most handsome in the family? And the second is, I'm serious, what role does your faith play in civility?
Yeah, my faith, much of what I've done in my life has been driven by my own personal faith. One of the reasons I said it was hard for me to find a volunteer opportunity, though, way back in 1986 that we were in Kenya, was that I wanted to be a physician, but I did not want to be a physician who was evangelizing my faith. If I was to evangelize my faith, it was only through an example as opposed to, with a religious mission. So I did not want to go with a religious mission. My sister actually had been with a religious mission, and I didn't want to do that. And back in that time, it was not, there was virtually no avenues. And this was even before, of course, Paul Farmer and Partners in Health and these sorts of things. And so we really were groundbreaking in that, Indiana University, groundbreaking in that regard. But my faith has driven me. In my faith, of course, my father was Jewish on one side and Christian on the other side, and I was brought up Catholic, with a little bit of both traditions, though. And then there's also no question, you will note that I did talk, and I was really being very, very serious when I talked about going to see the ballet and to see a touch of the divine. This notion that beauty, love, God, in whatever form you wish to call God, personally for me, it's love. This is the perfection that we all strive to achieve and engage in the struggle to achieve, realizing that, of course, we'll never get there, except those evanescent times when we truly feel love for one another, and then it goes away. Sir?
Now I read the purpose of culture. 3 Einterz. You said something about a good example. You had how many in your family? You said 11?
13 kids in total.
What did your parents do to make everybody so successful in one family?
Yeah. Thank you, Coach Johnson, for that. My siblings have been all 12 of my siblings have been very successful. And particularly if you go by how much money they got, because they're all richer than I am. It's like, oh, man, how did this happen? We had our struggles. We really did. We're like no other family. We were a big family, and there were issues within our family. But here again, I think the foundation for my parents was always one of love. And the foundation was a faith system. Now, I don't want to suggest to you that they didn't have doubt. In my own personal opinion, I think there's nothing more dangerous in this world than a person who has no self-doubt. Those people are frightening. So they had doubts, but they had a faith system. And they believed in God, who is a loving God, and they taught us that. And I think the New Testament, particularly, and one would ask, and again, not to evangelize here, but what would Jesus do? What would Gandhi do? What would Martin Luther King do? These are the questions that my parents taught us to ask. Getting a little, sir.
You were on the ground, and yes, how were you able to work with people there to combat the stigma of getting help for HIV?
The question was, how do I combat the stigma of HIV?
When you were in Kenya, to get people to come to the clinic, how were you able to do outreach in the community?
It was again, it wasn't people that looked like me and spoke like me. It wasn't Americans that could convince them to do it. It was the brave women. Particularly early on, it was the brave women who, they knew no one, if you will, died of HIV, right? Everyone died of pneumonia, died of diarrhea, died of wasting. No one used the term HIV. And so when these women were seeing their husbands die, they knew it was HIV, but no one ever said the word HIV. So these women came in, and this is where real courage was. These women came in, and they started on treatment, and they got better just like Daniel did. And I wish I could tell you the stories. They're just absolutely amazing, the courage of these women. And they then went out into the community. And, it doesn't take a lot, in a sense. It takes a few really brave souls, and everyone sees that they're getting better. And these were people, by and large, of integrity, people who were respected in their community. It takes all this. It just wasn't us. So it really took the Kenyans to do it. And it was a little trickle, and then it really snowballed. And it wasn't just them, of course. The world community, HIV, we saw here in our own community, right? Actually, y'all don't remember this because you were too young. Wouldn't even have known it. But, it was the gay community. And when I was in the hospital, working at Wishart Hospital, HIV now is cared for by infectious disease doctors. We had nothing to offer these people early on. They just came in and they died. And it was the most horrific experience that any of us who were practicing physicians at the time had ever had. And it was the gay community that stood up and said, we can't accept this. You know, if there's anything, apathy, we talk about apathy and complacency. There's no space for that if we're going to make a difference in the world. You got to it's a human tendency, apathy and complacency. You need to move beyond it. But anyway, I'll take one more. Yeah, thank you. I'm not watching the cutoff sign, but it's, yes, sir.
I believe there's probably a lot of students in here that aspire to be healthcare workers such as yourself. Can you talk about the role of human connection in administering proper healthcare and how that, have you seen that improve patient outcome at all?
Oh, well, of course, there's no question about that. So I think everyone, if you didn't hear it, the question is about human connection and will human connection improve patient outcomes. Can I point to the letter and verse in the medical literature about the research demonstrating that? I can't. I probably could if I did a literature search on that, but I can't do it off the top of my head. If you're asking me from my own experience, though, about the importance of human connection, it's as I was talking in Derek Nelson's class this morning, and he asked me to define healing. And as far as I'm concerned, real healing, in terms of for individuals who are truly suffering, real healing comes with the ability to give that individual hope again. And gaining hope again is all about human connection. I mean, it's a rare person who is able to find hope and do it completely independently. We need each other. We are a social species, and we need that human connection to survive. And our communities need it for our communities to survive. So, well, again, thank you so much. I really appreciate your listening, and best of luck.